Good evening. Thank you for joining us tonight. My name is Tabitha. This is Nina. And this is Carly, and we're student nurses at UW-Oshkosh.
Hello.
So tonight we are going to be doing a short presentation for visual, and also go through an app that you can take home for further reference.
Great. Okay, so starting out with our presentation here, I'm just going to be talking a little bit about heart failure. Okay, so I know that you have a new diagnosis of heart failure, but do you have a general idea of what it is?
A little bit, not really.
Okay, so basically with heart failure, it means that our heart is not pumping blood as efficient as it should be. So the body is no longer getting enough oxygen. Okay, and as you can see, we have a visual up there on the right for you. This is an example of bad role models. So this guy on the left here, he's smoking. And this girl in the middle, she's drinking alcohol. And the girl on the far right, she's eating foods that aren't healthy for her. But as you can see, while they're smiling and having a good time in the picture, their insides are not doing so well. So smoking, drinking alcohol, and a poor diet, a diet that's high in sodium and really high in fat, these are all major.
Alright, so some of the symptoms that you may have noticed prior to your diagnosis would include some of these. So maybe you felt fatigued, you had some difficulty breathing with certain activities, you felt like your heart was racing, maybe palpitations, something that you can't control or get under control, maybe swelling, getting up to urinate more frequently in the middle of the night than you have previously. Your skin seems to be shiny, more swollen as we mentioned. Your family may have noticed more restlessness and confusion. Some chest pain, as we mentioned with our
And drug therapy. And then farther down the line, you may also get a pacemaker implant just to help your heart to beat normally.
Okay, so then Nina is going to be covering the interactive app that we can use, but there's also a couple of resources here in the community that you can use. So the first option is that if you find that your symptoms are really affecting your life and your ability to manage your cares, home care is always an available option. They can come and help you with bathing and other hygiene and also meal preparation. And then there's also Meals on Wheels available for you, which is going to deliver meals right to your doorstep, which is really nice because there's no grocery shopping required. And then further down the line, if you find that your symptoms are still really bothering you, cardiac rehabilitation is always available. They're going to help you with the exercise program and help keep some of those symptoms under control.
Alright, so I think now I'm going to just discuss the app with you. So do you have a mobile device?
Yes.
I saw that you do.
I don't, so.
Alright, so I actually have one here for you.
Okay.
And I'm going to have you guys download the app right now.
Oh, okay, great, thank you.
So, alright, and then on the app, we're just going to have another review basically of like what is heart failure, basically the stuff that we talked about today, the risk factors, the symptoms that you may be having. There's also going to be short videos to kind of remind you like what's happening in your body, what's happening in your heart specifically, those symptoms that we talked about, like maybe what is edema, the swelling in your legs, that kind of thing. There's the ability to count your calories on there. We specifically want you to focus on your sodium intake. So keeping track of what you're eating daily, the sodium count that's on there, and then limiting that, obviously. There's also the potential for you to find substitutes for your meals. So if you use butter, maybe you use oil instead, so finding those alternatives in your cooking. There's the ability for you to journal your exercise and maybe also what you're feeling. So if you notice that something is making your symptoms worse, something that your symptoms better, we would like you to write that down so you're more aware of what your body's doing during this disease process.
Okay.
Do you have any other questions for us at this time?
Is the app free? Do I need to pay for it?
The app is totally free.
Okay.
You can use it whenever you'd like. We'll have options for you to fill in
Do
as
I
you
need
go.
Wi-Fi?
You do not need Wi-Fi.
Okay, great.
So you can do it while you're potentially walking with your family, doing some exercise activities at work, at the
We should
gym.
go for walks.
You should.
All right.
Thank
Do
you.
you guys have any other questions?
I
Not at
don't
this
think
time.
so.
You can go ahead and practice on the app,
Yeah.
and then ask us any questions too as you go along.
Okay, perfect, thank you. Thank you guys so much for coming in.
Yeah, thank you.
Thank you.